Hello, everyone. I'm Leah Binder. I am President and CEO of the Leapfrog Group, and I am here today with my good friend, Devin Jopp, who is CEO of one of, I think, the country's most influential organizations, APIC, that represents infection preventionists and really the movement for better infection prevention and control in healthcare in our country. So we are very much aligned as two organizations. Leapfrog, of course, is the employer-driven organization aiming at giant leaps forward in patient safety in our country. And of course, infection prevention is a very critical aspect of patient safety, one that we watch very closely. So welcome, Devin. Great to have this fireside chat with you.
Thanks, Lee. It's great to see you as always. And again, we're so grateful for the great work you guys do at Leapfrog in supporting and driving infection prevention control and keeping our patients safe.
Well, today we are going to each share some updates about our organizations, what we're up to, and maybe have some conversations where we have overlap in a lot of the issues that we're both addressing and some of the key concerns that we have with this new administration in Washington, concerns and opportunities, I mean, both. So we're going to have lots of opportunity to have a conversation, and we welcome if you have questions or you'd like to add your comment to do so in the Q&A, which is on the bottom of your screen. Just send your cursor down there and you'll find it. And we'll be monitoring that as we go, but hopefully we will have, at the end, we will set aside time for most of the questions. So with that, let me start with you. You can start, Devin. Tell me what's new at APIC.
Thanks, Leah. It's been busy times, obviously, since early January this year, and we'll talk a lot about our policy and legislative regulatory updates here in a little bit. So spending an inordinate amount of time there. Do want to talk obviously about one exciting thing this year is we have our new IP academic pathway, which is exciting. This is a initiative we've been working on for a couple of years that really helps develop undergraduate, graduate, and non-degree programs for how to develop the next generation of IP. So partnering with universities is the next step in trying to drive that out because we need more infection preventionists. Particularly as we look at not just acute care, but nursing homes and other kinds of environments out there.
There is a shortage.
There's a tremendous shortage. And I think, the problem is it's not going to get any easier. And I think we need some dedicated effort to really build the pipeline, if you will, for the future. The other thing that's kind of exciting is we created a white paper that looks at the impact of health disparities and inequities in infection prevention and control. And I think this was a really overdue white paper that kind of explored an area that hasn't had a lot of attention. But what is it? How do we start to begin to understand? Health disparities are real, and they certainly have impacts when patients walk in the door. And how do we account for that from the world of infection prevention and control? And I know that's something certainly, Leah, you guys spend a lot of time on as well at Leapfrog.
Well, it's very important to us that no patient is left behind. And we really need to make sure when we talk about safety or quality that what we mean is safety and quality for every patient.
Absolutely.
Really everyone in the workforce too, by the way. I mean,
right.
Really a holistic issue. And it's not as easy for some folks as it is for others. And we need to understand where those disparities are so that we can address them. We don't know where they are, we can't address them.
Absolutely. And I think that's one of the critical things is getting the data and actually even knowing where those are, right? And I think that is been a huge challenge in the healthcare system.
Absolutely.
The other one that we'll hit on too is we obviously, as you know, nursing homes and long-term care is also a focus for APIC. And so we do have we launched a new system called Policy Pro about a year ago, which has policies and procedures for hospitals. Well, we've just expanded a new library called for our long-term care Policy Pro. And so it's targeted at those that have nursing homes and long-term care facilities to be a resource. So we're trying to help, again, get the resources where they're needed and hopefully equalize and make for better patient care and outcomes by having better policies and procedures.
What kinds of resources are available?
So these are a pre-made set of policies and procedures that have been curated by our experts. And so we can have facilities can purchase those. They're a subscription-based model, and then we keep them updated. And we also have another version where they can even add to their own and use it as their own policy and procedure engine, which is kind of exciting.
Oh,
So
great.
these facilities really need the support, and I think it's great for us to be able to provide something there that for many times it's just one person sometimes wearing that hat. So, and then of course the other one, Leah, and this is a favorite topic of ours, is around hand hygiene. And
Yeah.
we did come out with that study where we had and we submitted that to you guys, looking at 390,000 hand hygiene observations, and found, with a 95% confidence interval that, we believe that, we found that really a sample size of 50 observations was comparable to 200 observations. And I know that's changed at Leapfrog. So, we continue to have that dialogue between our organizations, and certainly appreciate you guys considering it, even though I know it didn't make the cut this year for being changed, but appreciate the consideration.
Well, we appreciate that you did the study, and also that we want to really encourage others to do studies like that. I mean, we really need to understand better what are the best practices really for monitoring hand hygiene. We just talked about monitoring disparities. We got to monitor hand hygiene. I mean, this is something that we've known for, about 200 years was an important thing to do. And so we got to get really good at making sure that it's, 24/7, everybody's on board and everybody's washing their hands. So anyway, we think that there needs to be better and more research on the subject. And you made a really important contribution. We sent a letter to you, and we've talked about how we think that the statistical significance issue has to do with, for us, making sure that you can monitor and have a reliable set of data on whether you're improving or not. So if it's reliably showing that you have a 10% improvement next time you monitored, that's important. So for us, that was one of the issues that we had in examining your study, and we're digging into that more, and that's something we want to work with you going forward, and hope that others are continuing to do research like that, because it's very important. So
that's great. Thank you, Leah. Well, so I have to ask, what's going on at Leapfrog? I know lots of exciting things over there.
Yeah, well, we just put out our hospital safety grades twice a year. We put out new sets of hospital safety grades, and May 1st, we put out the spring 2025 grades, and we actually had some pretty good news to report during this cycle. And so one of the highlights we had in this cycle was we're now seeing a lot of hospitals that have continuously gotten A's over a period of time. That is very encouraging to us. So we call them straight A's. They've gotten A's for more than 5 cycles or 2.5 years. And that tells us that they've truly shifted their culture, because it's one thing to get 1A once, and that's a great thing. And every hospital should be proud if they get an A. But when you're able to continuously get A's, you've shown a really institution-wide change. You've hardwired safety in a way that others haven't. And so I think it's a particular issue that we're going to highlight. I know for me personally, if I'm looking for a hospital for somebody in my family or a friend, I'm always going to look at patterns of A's. If they've continued to get A's or continue to do well on certain measures that that are important to me. And that's also something that we offer in the safety grade. If you look it up on hospitalsafetygrade.org, you can dig in and you can see how the hospital did in all of the measures that we use to calculate the grade. So, there may be one that's more important to you than others, and you should look at it. But here's the other thing, Devin, I knew you're going to like this one, of something else we highlighted in this round of the safety grades, and that is very significant improvements in hospital-acquired infections.
Really awesome.
We look at 3 in particular, and we have seen really significant improvement, and really heartening that we, of course, saw a horrendous problem during the pandemic, where the curves sunk very low, and we saw reversal of prior progress very rapidly, and was distressing. But now it's back and it's better. than it was before the pandemic for most of the infection data that we're looking at. And that's at a national level, it's average. So not every hospital, unfortunately, is quite there, but it is very encouraging. So an attribute really to the good work of you and your members.
Well, thank you, Leah. I appreciate it. And we love, of course, that you guys shine a light on that. Any suggestions or tips for folks around how that Leapfrog's making a difference here, or how, if they're looking to consider maybe Leapfrog, and how that's going to help them there? Any thoughts?
We always hope people will tout their grade. And sometimes we see hospitals touting grades that aren't an A, and that's okay. I mean, there's lots of progress that you can tout and still feel quite good about your progress. And that's important. We want people, in healthcare, we talk about fee for service as, it doesn't work. It's all these problems. And yes, there's lots of problems with fee for service. But in my mind, one of the biggest problems with fee for service medicine is that we basically pay everyone the same, no matter how good a job they do. And by doing that, we actually don't recognize those who have really gone the extra mile to achieve something special for their patients. And so you have all these really smart people who go into healthcare, doctors and nurses and other health professionals and infection preventionists who go into healthcare. And they're really smart and they're really well educated and they're competitive because when you get an education like that, you're in a lot of competitive situations, right? And you exceed your peers sometimes, and you feel really great about it. And here you get this wonderful, position in healthcare, and you kind of live your dream of wanting to care for patients. But then what happens with fee for service is we say, okay, stop the competition. Now just be like everyone else. Doesn't matter how good a job you do, pay the same. And so, and I say all that to say one of our commitments at Leapfrog is to recognize hospitals that do go that extra mile and individuals that go that extra mile, to recognize them so that they can and maybe inspire a little bit of that competitive fever to want to do the best by your patients, because that's good for all of us and deserved by so many people who work so hard in healthcare. So my first statement to anyone in healthcare is recognize yourself, recognize your hospital, and recognize your peers when they excel, because it's gratifying to everyone.
Yeah, it's an excellent point.
Yeah. So that's our safety grade announcement. We also rank states. So I will tell you that Utah is like a superstar state. If anyone's listening from Utah, congratulations. Not only are they the #1 state this round in terms of percentage of A hospitals, but they tie for #1 state among straight A hospitals. So for having hospitals that have this continuous pattern I talked about. So anyway, but you can get all that from our website, and we're really excited about the announcement. We did have, I will say, one thing that's gotten a lot of attention in the news, so I might as well mention it, which is some tenant hospitals in Florida tried to get us not to publish their grades by suing us. We published their grades anyway, and they got D's and F's. There were 5 of them, and so we are continuing that and just simply highlighting, I think they have some significant problems with patient safety, and that's our purpose, and that's what we're showcasing. We recognize how hard it is to get a D or an F, but many hospitals have taken that poor grade and been able to actually use it as leverage to improve. And we've seen lots of hospitals go from bad grades to A's. And we hope that eventually these hospitals will kind of move on from wanting to shoot the messenger and actually go and improve the safety, because that's what their patients really deserve.
Yeah, it really is ultimately about quality improvement and keep raising the bar. So
absolutely. Well, hopefully we'll see that eventually. Couple other little things I want.
Please, yeah. And I hear there's a big anniversary out there too. For
yes, that's what I want to mention. You can see a point. Well, I can't point on it. Anyway, the 25 years at the Leapfrog Group. Yes, we're 25th anniversary, so we're excited about that. And we are going to be putting out some report, one report or two. I'm not sure yet, but we're going to be putting out information that is going to really look at the to the state of patient safety and its trajectory over the past decade, especially. Lots of really interesting new information I think people will be interested in. So that's one thing we're going to do. Plus, we're going to celebrate, and we're going to do that in December at our annual meeting, which is December 15th.
And I'm going to be there to join you. I'm looking forward to the festivities.
Yes, we're very much looking forward to it.
Well, Leah, maybe moving along, obviously we have the new administration here, and how's that impacting patient safety, quality, and infection prevention control from your perspective?
Well, I think it's a little early to tell completely, but we are encouraged by Dr. Oz, who is the new administrator of CMS, which is, I'm sure you all know, the agency that oversees Medicare and Medicaid, the federal side of Medicaid. And his comments about patient safety have been quite pointed. He's also talked about transparency, which we do believe is a critical element of progress on patient safety. You mentioned earlier about what people, how they can use Leapfrog and how they can use that to advance their own effectiveness of their own work in infection prevention. Well, I think transparency enables all of the kinds of things that Leapfrog's able to do. I know it does. And one of the things that we were encouraged about, even in his confirmation hearing, Dr. Oz talked about how he's seen transparency as the critical piece of progress. And so we couldn't agree with him more. I think he said it empowers people, which it does, and it gives them better tools. It doesn't just empower patients, it empowers the workforce too. So I was excited about that. I think he's got some really good ideas about improving maybe measurement and public reporting of that. And so, but it's a little early, of course, to be sure. Today he had an announcement working with CMMI on some new programs that also will potentially look at things like downside risk for providers, on risk-based payment arrangements, which, we'll see how that plays out. I think it's very important that we have really some tough tools out there that will say, you get real accountability when you get Medicare dollars. But at the same time, I think we'll be looking closely to make sure that's always driven by safety and quality. There's no, you don't want to pay for bad care. Nobody wants to pay for it, and there's no good price for it. We want great care, and that's what we want to make sure we're rewarding. But in any case, we're cautiously optimistic. And also in the last Trump administration, we were very involved, Leapfrog was, in the executive order on price transparency, which also included language on quality transparency. There's been an updated executive order, which we were excited about as well. So I think there is a commitment to transparency, and that, of course, for us is good. Where it's going to go with patient safety, we're still a little bit wondering, but the signs so far are good. What's your thoughts on that?
Oh yeah, I think we felt maybe a little bit more, not quite as positive experience so far on the infection prevention control side. And a couple of things, I think maybe starting globally and moving locally, I think the administration is, and a lot of this is through a lot of the fiscal conservatism going on of trying to roll back a lot of the funding is kind of creating these downward impacts. And certainly pulling out the WHO has created some challenges with being able to do global response to emerging infectious diseases. I think last I checked, I think there's 3 full-time people in the public health emergencies division of WHO. So
really,
so that's scary. I think the states really got hammered on the rollback of the ELC funding, the CDC supplemental funding. There's about $11 billion that was clawed back. And a lot of that was around pandemic preparedness and response and trying to build healthier communities, training, for example, in infection prevention control of professionals. And so I think, that concerns me, certainly in communities, like in one county, they had 6 infection preventionists, they went down to 1. How do we cover that if we have to scale up? I think a couple other things, Leah, that we're watching. Of course, the NIH grant funding and the overhead is having pretty big ripple effects. Even if it's, even if the courts uphold it for now, if it changes later, it would have significant challenges. But pulling back grants and then capping that is, we've had one hospital that came back and said their infection prevention control budget was cut by 25%.
Wow.
And that's in a large academic medical institution. So, and I think lastly, certainly there's concerns around some of the changes at CDC, and recently the elimination of HICPAC, which is the body that creates a lot of the guidelines that that hospitals and others follow. And those guidelines are really important. They include environmental decontamination, I don't know why I could say that today, surgical field sterility, and use of protective equipment, standard precautions. And without those guidelines, we're kind of left to navigate very complex infection control strategies independently. And imagine if we have, like, for example, another Mpox that comes out and there's no central guideline development. And I think that puts patients, healthcare workers at risk. So I think, there's, in the effort to try to be frugal, I think we're creating some other effects that we really need to go back and pay attention to make sure that patient safety stays front and center.
Devin, there's actually a question about HICPAC. Maybe we could address right now, since you just mentioned. Will groups like APIC, IDSA, and SHE carry the mantle of this group? It seems like moving quickly will be important before an alternative, less effective, more fragmented plan is implemented.
Yeah, I mean, I think the reality of it is we're still monitoring this. We are having discussions trying to figure out how do we do this and what can we do, knowing that also it's a very big job and it's a big lift. Setting guidelines is a multi-year effort. It takes countless dollars to have the infrastructure to do the validity and the testing around the development of this guideline. So the short answer is we are engaged, but we still are also working with the administration, trying to help them, that if not HICPAC, there needs to be some other method to be able to do this important work.
Do you think that the administration will restore some part of it or any of it?
I don't think they're going to restore HICPAC, though we really have been asking and encouraging him to. That's a very good model for getting feedback. But I think at the end of the day, the functions of HICPAC need to be somewhere. And I think we're trying to help them understand what that means. And I think, of course, the other problem we've got, Leah, is we don't have a CDC director confirmed yet. And I think that's also creating a little bit of paralysis there.
Oh, yeah. The one part of CDC that we watch closely is NHSN, which I know you do too, and that's so far so good. We think that they're continuing to function, but one has to always wonder. But that is the part of CDC that collects infection data and calculates SIRs, which is then transmitted to CMS for public reporting, and also. But in general, they work with all 50 state health departments. I mean, it's a very, I think it's a model of a very inexpensive effort to really, their budget is something like $50 million. I mean, that's a very small amount of money for
it is.
Washington.
Yeah, I think the president's budget came out and it was level funded. And, to be honest, it actually needs more resources. I think there's so much more that could be done with it. But in this environment, at least, keeping it, I think was, critically important to us to be able to do infection prevention control. But, stay tuned. I think this continues to evolve. It feels like on a daily basis.
Yeah. And that's it's truly a roller coaster ride here in Washington. I mean, we just never know day to day.
Absolutely.
I think another issue that, in general that we're looking at too is, and I touched on this earlier, but I think is important. It's probably not something infection preventionists worry about every day, but it is something they should be thinking about in general, which is payment reform efforts. I think there is going to be a real push in this administration to change payment. And, that's obviously been on the agenda for a long time. We've talked about value-based purchasing, things like that for a long time. But I think that this administration is going to shift a lot of effort towards CMMI to really implement some from pretty aggressive payment reform policies. And those will have direct impact, I think, on all of patient safety efforts, because downside risk is scary for health systems, very scary. So once they see they could lose money if they're not getting the kind of management discipline that it takes to have a high functioning health system, I think we will see some real change, and that has to impact infection prevention, hopefully to the positive, because it becomes clear right away that if you have a good infection prevention program going on in your hospital, you're in a better situation overall for everything.
Absolutely. Well, I actually had a question for you, Leah, on that. I mean, do you see, quality measures and this administration continue to support and double down in that direction, or what's your thoughts?
So far, what we've seen is a continued effort around patient safety measures, and they just issued the proposed rule for IPPS, and that, well, it was disappointing in one respect in that it proposes to eliminate the measure on social determinants of health, the questions that our patients can be asked to determine, what are the social factors impacting their outcomes. However, so we're unhappy about that. However, all of the patient safety measures seem to be full speed ahead, including a new patient safety structural measure, which we supported. So we were happy with that. I do think in a general sense, the vision is to streamline measurements so that for two things. One is it focuses on outcomes, which for most of the patient safety measures will keep them in the sites. I mean, most patient safety measures are very much outcome oriented. Certainly the infection measures are. At the same time, I think they want to prioritize measures that can be collected easily, and particularly through EMRs. There's continued effort, really. It's something that started in the last administration to begin to collect measures sort of in theory automatically through EMRs. And I think some of the EMR companies that we've spoken with are interested as well in creating the technology that makes that easier. So I think, I think that's all very positive. But we still have some concerns. There's actually today a discussion about meaningful measures and kind of going back to that campaign that started out of CMS in the last Trump administration. And we had some concerns about that campaign because we thought it potentially had too many cuts on the measures that are used to evaluate progress in hospitals. And I think if you're gonna cut something in our very expensive healthcare system, cutting measlement and accountability is maybe the last thing that you should go for, because there's not enough of that. But there is plenty of spending, but there's not a lot of accountability. So I think that is an area where we're going to be watching closely.
Yeah, no, it's interesting. You're right about the cuts in accountability and oversight, and I think we feel that same pinch is when healthcare facilities start having to swing the budget axe. We're like, please don't touch infection prevention control. Like that's one of the things that it's certainly huge payoff and dividends in keeping patients safe and not walking out with an infection that they came to the hospital with. I'll tell you another one too, Leah. I'd be curious what your thoughts are. Certainly, the talk of the town right now is Medicaid reform.
Yes.
And that certainly, as you and I know, has the potential for certainly more uninsured, which has a dramatic impact on the ability to get quality or patient safety, even in the first place, getting care. But I think that's another area where I hear and see a lot of concern by healthcare facilities around if this starts impacting their Medicaid rolls, just even on the financial side of it, it will be devastating and have kind of a repercussion of not just those that are uninsured, which is a challenge already, but then of course not being able to have that service or be able to service those patients within those facilities. So I don't know. Curious what you're hearing.
Oh, I'm hearing a lot of fear. This would be a significant blow to the hospital industry. I mean, and healthcare in general. I mean, it's there's a lot of concern and a lot of fear about what could happen to the industry, as well as, of course, what can happen to individual people who rely so heavily on Medicaid for everything. I mean, I think there's two areas too that I don't see highlighted enough in the press about the issues with the potential cuts to Medicaid. One is childbirth. So just maternity care in general.
Right.
It pays for half the births in this country, and it's already, there are quality challenges with there just are quality challenges with maternity care. And so already we have those. You cut Medicaid, and I can't even imagine where that's going to go. So we're going to need to be watching that for employers, like a lot of Leapfrog constituents. That's a concern for them too, because they pay for the other half of births, and they are very concerned about the quality of care, and just seeing that diminish, I think, would be it's a problem for all of us. We don't want, we want a better maternity care system in this country. And then the second piece for Medicaid pays for a lot of long-term care. I don't see that discussed as much. I know that that's a big issue for your members, but have you looked at the impact to long-term care of some of this?
Yeah, I mean, I think it's devastating, and I don't have the numbers in front of me, Leah, but I mean, to your point, that has become the safety net, and for when our seniors run out of financial resources, Medicaid steps in and make sure that they get the care they need. And I think, that also has trickle down effect of, if those patients can't get the support they need and be placed in those facilities, those facilities that rely on Medicaid patients, then what happens to those? And I think, again, it's always, taking the axe to the overhead. And I think those are areas where I think we just, there is a lot of fear, I think, and not a lot of answers, unfortunately, at the moment. So I think we're gonna have to see how this plays out in the House and Senate to see how much of that, really takes hold, or they step away from it at this point in time.
I mean, I think already nursing homes have had, and I'm using the term broadly. I know that nursing home is not a term of art for every single kind of post-acute facility, but whatever, nursing homes in general had some major challenges with infection, especially during the pandemic. But I can only imagine if there's major cuts to Medicaid, which is a lifeline for these facilities. I can't imagine what's going to happen.
Yeah, no, I agree. And I think, we've been advocating for those facilities to have dedicated infection preventionists. And I think, even some of the gains of saying that they had to have designated ones, I'm very concerned about it in this environment. So, nursing homes tend not to get the attention. They get overshadowed by the acute care facilities, but their needs definitely need to be at the table, front and center. And I think, I'm glad you brought that up, because they definitely, in this environment, could very much take a huge cut.
Well, over the years, Leapfrog has looked different times at whether we should be rating nursing homes. We're certainly still considering that, and because we do see the value, and not only in part because people pay cash. I mean, it's most people, Medicare doesn't cover it, and families and individuals are going to pay for their nursing home care out of their own pocket until they spend down, so to speak. Because they spend all their money, all their resources, then Medicaid would step in. So it's like middle class people who end up needing Medicaid this way. It's not only people who don't have the resources to begin with. Anyway, so people are spending very hard-earned money for their nursing home care, and they really deserve to know how these nursing homes are doing before they make these huge decisions about where to go.
Yeah, absolutely. Well, and I think, as the long-term care industry is a very fragmented not a one size fits all, right? Where you have your skilled nursing facilities, and then your assisted living and memory care, and so on and so forth. And I think, but regardless, I think Medicaid is an area that they rely on. And I think, it's the nursing homes need more investment, not less, at this point in time, particularly when it comes to patient safety. So, if you guys ever get the energy up around nursing homes, I would be personally very excited about that. So,
well, we'll stay in touch on that one.
Absolutely.
Sure.
I guess, Leah, as you're kind of looking ahead, like, what are some exciting things out there that that we were kind of in the doldrums here of some of the challenges of public policy, but what's exciting you right now?
Well, I have to say, and I may be the only one who says this, but I say it a lot, and that is I'm excited about making huge progress in patient safety. I see
Mhm.
the momentum, and I see it particularly in hospitals. I mean, we've just been talking about nursing homes. I'm not sure I see the momentum there. I don't know as much about nursing homes, but I don't necessarily hear that they're making all that much progress on patient safety, but hospitals are.
Mhm.
And that is important for us to first recognize. And I'm also excited about what we're going to see going forward. I think if we do have some bold efforts around payment reform that really recognizes excellence, I think we will see a real shift. I think we're headed in the right direction. Now, there's major challenges. I mean, we've just talked about many of them and the changes in this administration, but also I think just in general on some of the kind of structural issues we have as a country to deal with, which are how we're going to pay for all this healthcare. I mean, it's still about 20% of our GDP, which is a lot of money. And we we really do need to grapple with how we're going to have a more affordable, higher quality health care system. And we've been saying it forever, but we really need to do it. And anyway, but I'm maybe the last optimist. I am seeing real progress. The numbers we see at Leapfrog are extremely encouraging.
Mm.
And I just, I salute your members because you're really, really a part of that solution. And I hope that they don't get discouraged. It is discouraging to hear that when there are cuts to hospitals' bottom line, that they cut the infection preventionists. That just startles me, really. It doesn't strike me as a very wise move by anyone, but so hopefully we'll start to see that erode that pattern of behavior, let's put it, to
Right.
because we should be embracing infection prevention efforts. That is so critical to a functioning hospital.
Thank you, Leah. And I think, the role that Leapfrog plays in helping to keep a light on that, I think is really important. And I think, to be honest with you, even more important than ever now. And I think that's an area, you and I have spent time talking about this, but, an area for us is, of course, is IP staffing and how to do that well. And, APIC released an IP staffing calculator. And, that's been fascinating. We're to gather the data. We actually released some data across our hospitals that shows about decreases in HAIs when you get staffing right. And so staffing matters. It makes a difference. And to your point, I think hospitals will be wise to remember that when they're shaving things off, that's the last place to look, not the first place to look.
What do you see about this is kind of a bit of a controversial topic, I guess. Now, I didn't think it was controversial 6 months ago, but I guess it is now. What is your perspective on vaccines and where do you see that going with this new administration?
Yeah, I mean, I think from our perspective, we still, as APIC and as IPs, are very much strongly support vaccination, and I think it is a cornerstone of infection prevention is stopping it before you get it. And same thing about masks and PPE. I mean, that's something those are part of our arsenal of how to keep people safe. So we continue to advocate out there. We had put a statement out, I want to say a couple of years ago about healthcare workers needing to get their vaccinations. And, we should not be in a situation where, our healthcare workers are infecting our patients from vaccine preventable diseases. And I think we're seeing a lot of states that are considering bills weakening vaccination for healthcare workers. And I think that's not a good direction to be going as a country. So we continue to advocate for strong policy around that and stick to the science of vaccines. I think, that's the other side of it is I think there tends to be a lot of off messaging these days and misinformation that's gathering steam. You know, vitamin A is not going to cure measles, you know, but vaccination is going to really halt it. And I think that's the big message point: being fully vaccinated, not partially vaccinated. So you hit a passionate topic with me, Leah, but I think it's one where you know, there's a narrative out there that we're having to fight these days around that, which again, I to your point, I don't think I would have ever imagined that we would be here at this point. So.
Yeah, I mean, I think because of the success of vaccinations, many of us have grown up in a world where we never see the consequences of not being vaccinated. Like I don't think I've ever known anyone who had measles in my life. I remember chicken pox because when I was a kid, everyone had to get chicken pox, and I
Yeah.
remember getting it, and believe me, it was not fun. And I'm glad they have a vaccination for that, or a vaccine that my kids could get. But I, thank God, never known anyone who got polio.
Mm-hmm.
And when you read stories of people who did encounter, you know, had polio as children, it is devastating to read about, just absolutely devastating. And, you know, it used to be routine. Everyone knew someone who had polio. So, or a lot of people did anyway, it was common. And so just to have scourges like that, not in our lives, we've grown so accustomed to it that it's hard for us, as you know, just to understand how to balance risk and to recognize that this is a gift to our generation, that we don't have to worry about diseases like that.
Yeah, you know, it's if you ever go to the CDC headquarters, they have a great museum down there, and they have an iron lung sitting in there, and it
Oh, wow.
really reminds you of that. And I just think we tend to take health for granted, and for years, and we've known this, and among our infection preventionists is, you know, there tends to be this hurry up and focus on infection prevention, and then we walk away from it. And you know, and when it was SARS or MERS or you know Mpox, you know, COVID, of course, you know, we see this kind of spike and then we see this drop off. But the challenge is, and I know this resonates with you guys, is how do we really strengthen the whole system to make sure infection prevention is pervasive and constant? And I think that, you know, not whiplashing with the disease of the day has been a real problem across the healthcare industry.
That's a really good point. I think we do tend to categorize healthcare into like the specialties, the parts of the body, right? The specialist in this part and the specialist in that part. But I think what you're focused on, and certainly what Leapfrog is focused on, is how does it all come together to the benefit of the patient? How do we make sure that every aspect of what's delivered in any institution, healthcare, any facility, how do we make sure it all comes together in a way that makes sense and that protects the patient from the bad things and gets them the good things? All of that's not easy. That's incredibly hard. And the art and science of that is just as important as the art and science of cardiac surgery, because
Absolutely.
you have the greatest cardiac surgery in the world, and we have great cardiac surgery in this country. But you come out of it and you get an infection, you know, God forbid you die from that, or, you know, certainly suffer terribly from it. We've just undermined absolutely every bit of progress we could have made in cardiac care. So, I mean, I just think that understanding how everything comes together takes leadership and culture, and it's complicated, but it's also critically important. And that, by the way, is a concern that we've had in this administration, is what some mystery dismantling of ARC, which is the Agency for Healthcare Quality and Safety, which has really been a leader in coming out with best practices, toolkits, ideas for health systems to use in order to bring it all together. And unfortunately, that seems to, most of it has been folded under a unit of HHS, and we're just really concerned about that. I think a lot of the workforce has been laid off, and we're very worried about that. We're very concerned about the ARC transition.
Yeah, no, it makes sense. And I think that's the issue is, you know, we've built over decades this infrastructure to try to provide some support for the healthcare industry to address common issues, right? HAIs, right? And now all of a sudden we're in this point where once it's unwound, you know, it's easy to unwind, but how hard is it going to be to build back, or to build something even more effective? And I don't see evidence yet to suggest that there's something more effective on the horizon. It looks like it's just doing it in the name of cost savings, but I think you're right that ultimately that's got real ramifications to it.
So I think we have a few comments and questions.
Okay.
So let's see if I asked you the question about filling the void of HICPAC, which is a big one. And let's see. I love this comment. NHSN is a crown jewel of the IP world. Not even European countries or the EU CDC have anything like it. We need to protect it jealously. Totally agree.
Absolutely. Yeah. I mean, it's just, you know, that's again one of those systems. We have built it, we've perfected it, and you know, let's do no harm when it comes to things like that.
Absolutely. And also that, I mean, to me, it's not a small thing that they work so effectively with all 50 or probably more health departments. I mean, that's state health departments. That is extraordinary to be able to work so effectively and, of course, get all this data from healthcare providers. And that's not easy either. And they're able to do it, and they get great data, and they report it with a great deal of responsibility. And I think they need more resources. To your point, you made this earlier. I think they could expand their capabilities immensely. They already have the capacity to collect data from virtually any kind of healthcare facility. They aren't collecting it from all of them, but they could. I think that's an enormous resource that we should. I agree, it's a crown jewel, and we should be very proud of it.
Absolutely.
Since we are no longer associated with the World Health Organization, our administration is questioning if we should continue to promote the 5 moments of hand hygiene, or if we should adopt a different model for hand hygiene. Thoughts?
Promote hand hygiene, I think, is the, you know, no matter what form, you know, the 5 moments of hand hygiene, you know, there's been a lot of work around that and support behind it. I think the one thing maybe for your organization is, you know, there's a lot of toolkits available around that too, right? So, you know, particularly for smaller organizations, it's a lot easier to sometimes take a campaign and implement it within your organization than it is to adapt or create something new. So if you have the energy and it's more important to you, you know, to go and figure out how to build a campaign that's going to resonate, then sure, you know, take it, adapt it, and do something. But I would say that just because it's attached to the WHO doesn't make it bad, even though our administration is pulled out of it. You know, I continue to preach that, you know, the APIC continues to be very involved with WHO. We are part of the Global Infection Prevention Control Network. That doesn't change with our administration pulling out. And we work bilaterally with other country societies as well. So anyhow, that's a long way to say that if it fits within your organization and your model, then definitely promote it. And if it's something that you need to modify, then please take the opportunity to do that too.
Well, I hope also, I think this is Kristen, I hope that your administration is by your question is not actually questioning, you know, core values that World Health Organization would promote, that I'm sure you agree with, one of which is we should be vigilant about hand hygiene. So regardless of what the US does in its relationship with World Health Organization, your organization at least should uphold your core principles. And even if maybe you don't work with the World Health Organization as much as you did before, but regardless of that, the core principles should prevail. And I hope that sounds like that's something that's important to you, but it should be important to your administration as well. I am extremely worried about my job security as an IP. Will there be a need for infection preventionists if NHSN is abolished?
Well, yeah, I mean, and I think, you know, I hear this, of course, from others, that, you know, there's fear out there. And I think we were talking about that earlier, you know, around Medicaid or some of the other things happening. The one thing is, and Lee and I were talking a little bit a while ago, is in the president's budget, NHSM was level funded. Now that doesn't mean it's a done deal, right? It's got to go through the House and the Senate and be conference and so on. But if that stays, then we don't see NHSM necessarily going anywhere. I personally think it would be very difficult for the administration to get rid of NHSM because it's tied to so many things, right, including payment. And ultimately, then what happens, right? Then 50 states would have to do something, and I don't even want to contemplate how challenging and difficult that would be. But at the end of the day, I do understand your fear. I don't think it's going to go away because of NHSN going away. I think the role of the IP is going to continue to be important. Reporting is still going to be important. And of course, IPs are so much more than just reporting, right? And I think that's the other side of it is, it's the rounding, it's everything else that we do, as part of our work. So thank you for sharing your fears with us and hang in there. I know it's the news cycle can be a little daunting each day.
Yeah, thank you for sharing. I echo that. I'm sure it's scary right now, and I can only say that from the point of view of Leapfrog and what we do, we are trying to make it clear that your job is among the most critical in our country. We consider it extremely important that patients are protected from infections and workforce is protected, but particularly we're focused on those patients. And you're the ones that are out there fighting that every day, and we believe in what you're doing. And so we are going to bring all of our resources outside of what you do. So outside in the community, we'll try to bring those resources to bear to make sure that your role is protected. So that I can only say we'll work from the outside and you work from the inside. We'll work together.
Absolutely. And we appreciate your support, Leah. And again, that means everything to us, as I mentioned earlier, now more than ever.
Absolutely. But it also is disturbing that it's even on the table. To me, it's sort of honestly like a no-brainer.
Yeah.
You gotta be great at infection prevention if you're going to run a healthcare facility. I don't see how that's ever not top priority. But that's just me.
Well,
And you.
I'm 100% behind you on it. So
Right. You and me and all of everyone in this webinar today. So infection preventionists and healthcare epidemiologists are generally unhappy with the administration's actions, which are impacting public health efforts. Would you agree with that?
yeah, I would. I think we've touched on a lot of the different areas there, and thank you, Joan, for your comment, by the way. This is a difficult time, and I would call it unprecedented time. And we were having some internal discussions about this recently. During COVID, it was very challenging for our IPs and epidemiologists as they were on the front lines, but we were fighting a common enemy. And this time around, there's just so much unwinding and kind of deconstruction, I'm going to say, of the healthcare system that we're having to then kind of fight all these different battles at one time. And it's somewhat a battle for the survival of our facilities, our patients, and again, I'm not coming down critical on a political party, but I am saying that at the end of the day, we can't be a penny wise, pound foolish. Like we got to make certain cuts. Nobody argues there, but we've got to do so and be pinpoint. And I think that's where the challenge has been, to be quite frank.
And I do think this administration is committed around prevention
Mm-hmm.
and around chronic disease, and a vision for healthcare that is beyond just simply intervening when all the worst things happen to a patient and kind of ignoring all the things that led up to it.
Right.
That really is a philosophy I'm sure we can all embrace. Hopefully they will live that philosophy, but the signs right now around public health are troubling. I agree. Leah, can you comment on the work Leapfrog is doing regarding environmental hygiene? Yes, we have a work group that's part of our Partners Advisory Committee that is looking closely at it. Actually, Devin's part of that. And looking closely at what are some standards for a whole variety of environmental hygiene issues. So basically air and surface, everything in between. We recognize that those are really important issues to how safe a patient is, obviously. And it's obvious, but we don't actually see all that many measures right now that are out there or standards on what, what we see competing standards. We don't see like fundamental standards on what health systems ought to be doing to protect their patients. And that's where we're getting some incredibly good advice right now as we look at all of them and try to synthesize through all of the literature that's out there, which is some literature that's good. And we have a website on, it's not a web, I guess it's a page on LinkedIn. It's called something. It's this platform on LinkedIn where we are publishing some papers, and we welcome anyone to get on there and chime in, because we're really looking to understand better what role we could play, but also just to understand this world in general. Let's see. Okay, I think I got to the questions.
It looks like
and
it.
Paul Alper, my good friend who's on this, has posted. I don't know if everyone can see this. We'll send out to all the participants a link to that LinkedIn site that I mentioned.
Yeah, hiding in plain sight, I think is what it's called, right?
Yeah, it's a good one. So what do you think? What do you think's next, Devin? What's your prediction for 2 years from now?
Yeah, it's interesting. I keep saying to people, we got to see how deep the pool is. And I feel like right now we're kind of in that testing phase to see where it is. If these Medicaid reforms go through, I think we're going to see some difficult times for healthcare over the next 2 years. And I think, that's going to be a headlong challenge. And, always the unknown is, what happens if an emerging infectious disease comes? And I think, if that happens, and I don't wish it or ever hope for it, but, if history bears repeating, which it will, that would change the calculus. But I think it could also have some very difficult challenges for us to face if we're not ready. So, Leah, I maybe have a little bit of a grimmer picture right now around healthcare's ability to have the financial resources to support it. I do maybe we'll take a positive spin that I do think some of the work around like AI and some of the other areas are exciting.
Yeah.
Particularly as it's looking like use of AI and EHRs to do predictive and modeling and analysis. And I think some of that's going to continue to hope to make a difference. So that's my glass half full at the end there. How about yours?
I would agree with the AI prediction. There's certainly, that's a two-sided coin, because there's certainly some problems and hazards ahead on that too. But we are very excited about the predictive modeling. We're very excited about the opportunity to prevent safety events from actually happening in the first place, and AI can certainly help with that. So we've seen some good examples of technology being deployed in some very exciting ways. So we're cautiously optimistic there. We certainly have some hazards and some problems ahead, but those also create opportunities. And one opportunity that I want to encourage the audience with is the opportunity to make your case. And, for all of the hardship that's involved in any undermining of our progress on patient safety or infection prevention, all of those big initiatives that create a lot of fear also give us the opportunity to say, this is why what we do is so important. And here's the evidence. It forces us to make our own case, because if we don't make the case, we just go away. So I think let's take that as the opportunity. Let's fortify our courage, and let's get out there and make our case and make sure that no one forgets the impact of everything that everyone on this call has accomplished.
Yeah, I can't build on that, Leah, too much. I think you said it perfectly. At the end of the day, we have to fight for our patients and our workers. And
Yes.
I think, that's using tools out there to help justify things like the IP staffing calculator, anything you lay your hands on, the Leapfrog scores, and, please do lean on those as your tools of during this time. But, and I think just finally, hang in there. This is a
Yeah.
marathon. It's not a sprint. And, somebody once told me the Republic will always find its way. And I think we have to kind of hold true to that. So,
And we're with you.
yeah, absolutely.
It was great talking with you, Devin.
Likewise, Leah, you're the best. Thank you so much.
Thank you all.
Take care.